Hi, welcome to the Back on Track Achieving Healthy Weight Loss podcast. I'm your host, Dr. Shelly. Can you be living with obesity and malnourishment at the same time? Well, the answer is yes, you can. Over 50% of patients with obesity have nutritional deficiencies. Mind blown. I never thought this could happen. And the malnutrition is defined by the World Health Organization as deficiencies or excesses or imbalance in a person's intake of energy or nutrients. And there are two broad groups that have this condition. The first group is the one you think of, the one who's undernourished, who has stunting, low height for their age, low weight for their age, underweight, and just have, not able to have access to nutritious foods and tend to have more of that micronutrient deficiency or a lack of vitamins and minerals. The other group actually is individuals who are overweight and are living with obesity and have diet-related non-communicable diseases such as heart disease, stroke, diabetes, and cancer. And you can be malnourished from either an overall lack of calories, because I have patients who are living with obesity and not eating enough, and therefore they're not getting their protein, their vitamins, or minerals. And now they have a deficiency because eventually that gets depleted. Or you can be the opposite, where you have so many excess calories that your body does not know what to do with them. So today we're going to kind of talk a little bit about living with obesity and malnutrition at the same time. And what are some things that we can do to help with avoiding that? But before we get there, let's talk a little bit about why does obesity and malnutrition occur? So in the US, including children and adults, they consume 27 to 30% of their total daily calories from low nutrient sugary food. And despite consuming such high calories from these low nutrient sugary foods, the calories have such a lower quality of nutrients that it create nourishment that people experience. And they may not even know it. They may be having symptoms and not be aware. And there are some mechanisms of malnutrition, such as inadequate intake, not getting in the nutrients, the vitamins, the deficiency. Also, defective storage and bioavailability of the nutrients. So there are some vitamins who are fat soluble, specifically vitamin A, vitamin D, vitamin E, and vitamin K. These vitamins are stored in the fat. They're fat soluble, so they get stored in the fat. Everything else is stored, throughout the body. And so if there's some defectiveness with the fatty tissue or have excessive adipose tissue, that can make it difficult for these vitamins to be available for use for the body. Also, if someone has small intestine bacterial overgrowth, or SIBO for short, this is where the microbiota, or just the bacteria metabolize in our stomach, in our gut, metabolizes vitamins. And if you have too much bacteria, it could be metabolizing the vitamins and reducing what's available for us for the rest of the body. Also, the excessive consumption of simple sugars, milk, and fat. When someone takes in excessive simple sugars like your cookies, your cakes, your donut, things that are very simple and broken down rather quickly, it actually can deplete your thiamine stores. And lastly, there are several medications that can be actually contributing and putting you at risk for having malnutrition. Here are a couple of them, specifically furosemide or torsemide, or they're in the category called loop diuretics. This can actually put you at risk for thiamine deficiency. Metformin can put you, which is used for diabetes, can put you at risk for thiamine and vitamin B12 deficiency. Orlistat, which is a medication that's used to help with losing weight. You basically don't absorb fat. You just basically, if you eat an extra fat diet, you're just kind of pooping it out there. And that can lead to a deficiency of fat soluble vitamins, like I said, vitamin A, D, E, and K. Also, certain blood pressure medications like the ACE inhibitors, such as lisinopril, benazepril, enalapril, these can lead to decrease in vitamin B12 deficiency. Also, if you're taking you have a lot of acid reflux, that the H2 blockers like famotidine, ranitidine is no longer on the market, and protein pump inhibitors like omeprazole, esomeprazole, or pantoprazole, these can actually lead to deficiencies in vitamin B12, thiamine, iron, calcium, and magnesium. If you have gout and you're using colchicine, that can lead to vitamin deficiency of vitamin B12. If you're even on an oral contraceptive, that can lead to deficiency of folic acid or folate. So these are just some medications that have been implicated in malnutrition. Now, the most common vitamin deficiencies are going to be your vitamin D, your iron, vitamin B12, vitamin B1 or thiamine, calcium, magnesium, and vitamin A. We're just going to talk about the top 3. Now, vitamin D, some risk factors for vitamin D deficiency include inadequate intake, just not getting in your diet, and then also limited sun exposure. Some, especially during the winter, if you're in an area where it's heavy snow, you're not really getting out into the sun and getting that at least 10 minutes of sun, that can lead to decreased vitamin D just because it needs to be activated by the sun. And also sometimes if you are using sunscreen, that too can block vitamin D. Now, I'm not telling you to stop using sunscreen, but you should still use sunscreen. It could put you at risk for just skin cancer, but still just knowing that, there has to be a catch-22. Sometimes that sunscreen can put you at increased risk for vitamin D deficiency. Now, vitamin D deficiency is associated with an increased risk of infections, autoimmunity, cancers, chronic diseases, and poor bone mineralization. When you do lose weight, it can cause vitamin D to be released into the blood, but usually those effects are not substantial enough to compensate for the deficiency. So it is important to try to increase your intake of vitamin D. Now, the next vitamin I want to talk about is your iron. So iron is so important for forming the red cells that carry the oxygen to the different parts of the body. And it can be stored as 2 types of iron. You have your heme iron that is found in red meat, poultry, pork, and seafood. And then you have your non-heme iron, which is obtained from beans, dark leafy greens, iron fortified cereals, and things of that nature. And usually that's absorbed rather well when you take vitamin C together. Some of the risk factors for iron deficiency include menstrual cycles, because as women, we are losing blood every month, and that can lead to less iron availability for the body. Also, excess tea consumption can also lead to some iron deficiency, and then gastric acid decrease. And that can be due to diseases or medications such as your famotidine or your omeprazole, Nexium, things of that nature that kind of reduces the gastric acid. And the reason why that's important is that when the gastric acid is reduced, it actually stops the iron from being converted from ferric to ferrous iron. And usually ferric is more readily absorbed. So let's talk about vitamin B9 or folate acid. Folic acid is so important in the formation of red blood cells, and it helps with amino acid metabolism. Some of the sources are leafy green vegetables, orange juice, lentils, beans, and fortified grains. So the extra adipose tissue that one has when they are living with obesity does not affect the folic absorption, but it can affect how it's distributed. And folic acid deficiency can be associated with cardiovascular disease, cancers, megaloblastic anemia, and fetal neural tube defects. Last but not least, let's talk about vitamin B12 deficiency. Now, vitamin B12 affects your neurologic functioning. It also helps with maturing the red blood cell and cellular metabolism. You can find vitamin B12 in your fish, your red meat, eggs, and dairy. Vitamin B12 is released from protein by the gastric acid. Vitamin B12 is a water-soluble vitamin that is stored in the liver. When you have you can have an increased risk of vitamin B12 deficiency when you have an overgrowth of bacteria, especially in SIBO, that small intestinal bacterial overgrowth, or surgical alterations such as bariatric surgery, which can lead to vitamin B12 deficiency. And this deficiency can be also found in patients who have Crohn's or celiac disease. Certain medications that increase your risk for vitamin B12 deficiencies are your metformin, your ACE inhibitors such as lisinopril, enalapril, benazepril, your H2 blockers such as famotidine, or protein pump inhibitors such as Nexium, esomeprazole, pantoprazole, and of course, colchicine. And so why do we worry about vitamin B12 deficiency? It's because it can cause megaloblastic anemia, or just your red cells to be extremely larger, peripheral neuropathy, which is numbness and tingling in your hands, your feet, or different parts of your body, and for some people, neuropsychiatric manifestation. Now, that's just part of the vitamin deficiencies. Now, individuals with obesity are at increased risk at baseline for this due to malnutrition and macronutrient deficiencies. But when these same patients are trying to lose weight with strict weight reduction diets, their nutritional deficiencies can worsen. And so we're just going to talk about 3 most common diets that can lead to increased risk of micronutrients or malnutrition, and vitamin deficiency. And so the top 3 are your low carbohydrate diet, your intermittent fasting or time restricted eating, and your ketogenic or keto diet. Now, your low carbohydrate diet typically limits carbohydrate intake to 30 to 120 grams per day. The lower carbohydrate diets, which are less than 60 grams per day, often have significant weight reduction. However, these diets can put you at risk for deficiencies in fiber, folic acid, potassium, calcium, magnesium, iron, vitamin A, iodine, linolenic acid, and alpha-linolenic acid. So several deficiencies. When we look at the ketogenic diet, that diet is high in fat, moderate protein, and carbohydrate restricted diet. It definitely can allow people to lose weight, but it can put you, because it limits the intake of fortified carbohydrates, it can lead to thiamine deficiency. And when we look at your intermittent fasting, this is a dietary approach where you have consumption of foods within a restricted time window to generate fasting periods. And they have different types of intermittent fasting. Do alternate day fasting, periodic day fasting, and fasting mimicking diet. And the modified alternate day fasting is where calories are restricted every other day, but they can be low in fiber, potassium, vitamin A, iron, calcium, iodine, magnesium, iron, linoleic acid, and alpha-linolenic acid. Now, with these different diets, they definitely are very helpful in losing weight. However, I would say it's important that you get tested, check with your primary care, your obesity medicine specialist to check your vitamin levels, especially before starting and during, to make sure you're not developing any deficiency. It may be beneficial to start a multivitamin or strategic vitamin if you are deficient to help improve your levels, especially with doing these diets. So I'm not saying you should not do these diets. I'm just saying that we need to monitor. So it's important that your doctor screens you and they're watching. Also, it's important to avoid the processed foods of simple sugars that can also put you at risk for malnutrition and vitamin deficiencies, focusing on foods that are higher in nutrients and the vitamins that you need throughout the day. So not only are you losing weight, you are actually reducing your risk of deficiencies and reducing your risk of malnutrition, because who wants to be living with obesity and malnutritious at the same time? So I hope this is helpful, just something to be aware of. I know it's a lot, but like I said, make sure that your doctor is screening you for these deficiencies just to make sure you're doing okay. Alrighty. Thank you so much for listening and tuning in to the Back on Track Achieving Healthy Weight Loss podcast. If you have any questions, feel free to leave a comment. Let me know. I'll be happy to answer and create a podcast maybe for you. All right. You can find me on TikTok, Instagram at Dr. Shelly MD. And I look forward to seeing you next week for the Back on Track Achieving Healthy Weight Loss podcast. And if you liked it, please give me a 5-star review and don't forget to subscribe and like it. Thank you so much and see you next time.